Hello, my article is on the importance of monitoring of osteoarthritis. Osteoarthritis is one of the most common diseases in middle or older adults. In fact, you and your doctor should be paying more attention to even it before it happens. Because if you live long enough, it almost will certainly develop in one or more of your vital joints. There's much you can do to forestall it, minimize its symptoms, and overcome the disability that can result. Even what you eat and don't eat, and if you exercise, can affect your risk of developing arthritis. Recent evidence indicates that osteoarthritis is not simply the result of years of wear and tear on the cartilage, the important joints like knees and hips. Rather, it may be promoted, perhaps initially caused by chronic low-grade inflammations, that is now also linked to other major chronic illnesses, including heart disease and Alzheimer's disease, in which the diet and exercise may play a proactive role. One of the biggest mistakes people make with arthritis is to limit movement of the affected joint, which leads to stiffness and weakness that may only makes matters worse. The resulting decline in neuromuscular function, especially balance and walking speed, is a major risk factor for falls and fall injuries that too often lead to costly hip replacements and lasting disability. In 2011, osteoarthritis accounted for 95% of the 757 total knee replacements and 80% of the 520 total hip replacements in the country. The United States Bone and Joint Initiative reported these statistics. Much is known about the factors that increase the likelihood of developing arthritis, several which are related to the way people live their lives, the most important of these being overweight or obese. For the future of millions of American adults, half whom now weigh a lot more than they should. Every extra pound increases the strength across the knee joint 3 to 5 times. This is per a study that was done in the University of Cleveland. Nutrition is obviously a big part of what needs to be done with losing weight and especially in our elderly. When researchers in Norway tracked more than 1,600 people with healthy knees for 10 years, those who were overweight or obese were 2 to 3 times more likely to be diagnosed with osteoarthritis of the knee than those who were normal weight. Even a very moderate weight loss of 10 to 12 pounds in a person weighing 250 pounds can reduce the pain disability associated with arthritis, joint injuries, as well as surgery. It's basically a body-wide increased inflammation may explain why some people get arthritis in joints that are not weight-bearing, like fingers. Also, damage, exercise, sports, or anything like that you've gone through some type of dramatic damage to the knee. Sports players, things like that, they can end up with osteoarthritis in certain joints. Obviously, a big part of what you can do is be eating the correct foods. Stay away from carbonated drinks. There's certain carbohydrates that are better than others. Trying to stay away from trans fats. Obviously, just having less processed meats, fruit juices, less sodium, and obviously alcohol. Obviously, it's a disease that is going to affect majority of the population, and it's something that needs to be constantly monitored, especially with the increase in certain joint replacements that are happening in the United States more and more, and they seem to be tied to maybe possibly now obesity or overweight in the elderly, or even going down to the middle age.